Infertility is an issue many couples across the country are struggling with. According to the Centers for Disease Control, about 6% of married women are unable to get pregnant after trying for a year. So they often turn to fertility specialists for help. We've got one here with us this morning, Dr. Jose Pliego with Scott & White. Good morning to you.
Good morning, Erin. Thank you very much for giving me the opportunity to be here with you.
You are welcome. Thanks for waking up early with us. Let's start off with a simple question of what is infertility?
Well, the typical definition of infertility is inability to conceive after trying for 1 year. But there's exception to those rules, and not everybody should wait a year. For example, patients that are over the age of 35 should seek infertility services early. Somebody that has an obvious reason, for example, irregular cycles or no periods, should come and see us early. A couple that have high anxiety levels over a short period of not conceiving, that person also needs to be evaluated. And obviously somebody that has surgical procedures done, pelvic surgery, for example, or tubal factors infertility.
Got it. So if you already know some risk factors are going on, if you're starting late, it's a good idea to just already be working with a doctor from the get-go.
Exactly.
Let's talk about some of the most common causes of infertility.
Well, some of the most common causes of infertility is problems with the male, problems with ovulation, and then problems with the fallopian tube. So that's your typical majority of problems. If you want to figure out which one of the problems is the most common one, male factors account for 40% of infertility. Ovulation problems 20%, and tubal factors 20%.
Can problems with the male be easily treated?
Unfortunately not. The majority of the problems with the male are difficult to treat because we don't have medications that will increase the production of sperm like we do have medications that induce ovulation on the female. So a lot of times what we end up doing if we have a gentleman that has a low sperm count is do in vitro fertilization, because you don't need millions of sperm to fertilize an egg in vitro like you do through the normal sexual intercourse.
Is it becoming more common? I guess people refer to it as IVF. Is it more common these days?
It is a lot more common because it works. You know, prior to IVF, it was very difficult for us to treat male factor infertility, and it was very difficult to treat tubal factor infertility. But now we're using IVF to treat unexplained infertility. Normally, if you think about what is the probability of a couple of getting pregnant in 1 month, and the best condition is 20% per month. So if you have 100 couples to go to the honeymoon and don't use any contraception, 20 will be pregnant in 1 month. In 1 year is 85 to 90%. And if those 10 to 15 couples that didn't get pregnant try it again for another year and they don't, they're going to be self-selected, so their chances of getting pregnant per month is 3%. So with a lot of this fertility treatment, what we're trying to do is increase this probability of getting pregnant. For example, superovulation, artificial insemination will increase that chances from that 3% to about 10 or 11%. But if the patient is over the age of 40, only to 5%. So there's a huge difference when we're talking about fertility treatment, you know, in regards to what is the age of the patient, because that determines the success rate, both for natural conception and also for treatment.
Got it. Now we've got up on the screen just real quickly some of the key ages of fertility. You tell me at age 30, fertility decreases, at age 35, even more, and the best time to conceive in your 20s.
It's in your 20s.
All right, Dr. Pliego, thank you so much for being here this morning. Some good information.